Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, President Bongbong Marcos allows the voluntary use of face masks in outdoor places. But a health advocate warns over confusing health policies against COVID-19. Dr. Tony Leachon joins us live. And later, a lawmaker wants to abolish the PCGG, saying the agency outlived its usefulness. Manila's 6th District Representative, Benny Abante, tells us more later in the program. President Bongbong Marcos has signed an executive order allowing the optional use of face masks in outdoor areas. The EO states that voluntary wearing of face masks will apply in open spaces and non-crowded areas with good ventilation. Masks are still recommended for those who are not fully vaccinated, senior citizens, and immunocompromised. Let's go straight to the source of the story. First off, we have health reform advocate Dr. Tony Leachon. Dr. Tony, welcome back to The Source. Maraming salamat po sa inyong oras.
Magandang umaga, Pinky, and thank you for the opportunity to add value to your program.
So, unahin na po natin your reaction on the policy. I believe this was effective yesterday on the voluntary use of face masks when, let's be clear, outdoors.
Yes, supportive naman tayo dun sa executive order. Only the timing is off. I think it's premature considering the scientific data. One is the positivity rate natin is national 11%. Alam natin ang WHO target is less than 5%. NCR, according to the Opta, meron kang konting surge. The positivity rate is 13%. Ang booster rate natin is one of the lowest in Southeast Asia, around 18 to 23%.
Yeah.
And then ang cases natin, by the way, ay 2,000 pa lang. To consider low risk, dapat less than 500 tayo. So, by scientific data natin, parang hindi pa siya. Then, Pinky, the other one is the, it will water down or dampen the Pinas Lakas program since the President wants no more lockdowns and is anchored on his call before na to augment the booster program by launching the Pinas Lakas program. In fact, meron pa siyang national vaccination program slated September 26 to 29 and liberalizing the face mask outdoors baka ma-water down yung effort ng Department of Health in terms of the vaccination program natin.
In fact, that's what I wanted to ask you, Dr. Tony, if this will actually encourage or discourage the public from getting boosted.
It might actually confuse Pinky, considering parang relax na tayo doon sa masking. Ang face mask natin is the protective gear. So habang hindi pa mataas yung booster natin, parang kontra sila. While you are pushing, let's say, the booster program to increase the wall of immunity, while you're doing this, the face mask should be worn pa rin. Kasi the virus is airborne. So what I'm saying, since meron silang first 100 days target, the EO, sana after that nila ginawa or nirelease because it would be timely o yung facing lang. So kunyari, you want to perk up the economy, yes, but let's support muna the Pinas Lakas program, the booster rate. And I think by rallying the people to that, then that's the true essence of unity. Yun ang aking tingin dyan.
Oh, let's talk about that wall of immunity. Paki-describe, pakilarawan po sa amin, Dr. Tony. Ano ba ibig sabihin ng wall of immunity? Kasi over and over again, experts will tell us if you've received your primary dose, nagkakaroon ng waning of immunity after about 5, 6 months, kaya kailangan magpa-booster shot. Ano ho ba itong wall of immunity?
Ito yung pagpoprotekta sa iyong immune system after vaccination. And nakikita natin ang kailangan natin is two primary vaccines, and then this after the vaccination, humihina yung ating immune system 3 to 6 months. That's why we need two more boosters. Pero ang kailangan natin na sa minimum requirement ay two primary vaccines and one booster or third dose. So yesterday, I was surprised with the um statement of Press Secretary Trixie Angeles when she said that we're 6% away from the wall of immunity. And I was looking at that, and apparently tingin ko wrong data because 93% ang nilagay niya kung alluding siya to the 73 million, but we need two three doses. So lalabas tayo na hindi yun. Because the denominator should also include yung mga ages 5 years old eh. So dapat binago mo yan. If you're gonna to compute that, it will account to about
Okay.
66%. And our booster will actually be
Yeah.
decreased from 23% to 17%.
Doc Tony, let's
So
clarify
medyo
that. Let's
conflicting
clarify
siya.
that because that was also something I was thinking about when the secretary talked about this wall of immunity. That's why I wanted to ask you. Let's describe, pakilarawan sa amin. Ang wall of immunity, parang sa Tagalog po, gaano ba karami sa atin? Hindi ho ba ang protektado? Tama ho ba yun? At when we say protected, ang ibig sabihin nun ay nakapag-primary dose na po tayo at nakapag-booster. Tama ho ba yun sa aking pag-intindi?
Tama po yan.
Okay. So,
Kaya lang po,
sir,
opo.
sandali lang po. So I want to bring up the data that we were flashing a while ago. We have a complete dose, those who have completed their dose at 72 million. So ito nga po yung tinatawag nating booster dose. Right now, we're still at 18 million. Very, hindi ho masyadong mabilis yung pagtaas ng pagkuha ng booster. So, how does that relate to the wall of immunity?
Well, ang wall of immunity, dapat pantayan mo man lang yung primary boosters mo. Like for example, the reason why the other countries nag-optional na silang face mask kasi doon nila binabangga tayo, let's say sa Singapore and other countries in Southeast Asia, because their primary dose ay nasa 90% na at ang booster nila nasa 80% na. Now, in this case, ang baba ng ating booster rate. Kumpara mo sa Asia, ang average ng buong Asian region ay 30%. So dapat man lang, ang tingin ko man lang, at least naka 50% ka. So let's say 18. Ang kulang mo na lang dyan is about 32 million.
Opo.
So kahit ubusin mo
Dami
yung
pa rin
23
nun.
million, we could not come up.
Opo,
Oo,
opo.
hindi natin matatapos yun. So, kung kukumpitin mo yan, the data is actually wrong because they presume that based on the eligible population in 2021, 93.18% have been fully vaccinated or close to 73 million. But the Department of Health has not adjusted the denominator
I
based on the
see.
eligibility as the age allowable for vaccine has been decreased to 5 years and up, which means even following fully vaccinated definition of two vaccines, only 66% of the adjusted eligible population are fully vaccinated. And this pushes the eligible boosters to even a lower rate of around
I get what you're
17%.
saying. I
Dun
understand.
siya, Pinky.
Opo,
Oo.
naintindihan ko na yan. Kasi parang sinasabi ninyo, ang pinagbabasehan ng numero ay yung primary dose na yung mga adults. That's what you're saying. But dapat
That's
at this
correct.
point in time, isinama na po, hindi ho ba late kasi napasama na pwede nang magpabakuna yung mga 5 years and older. Hence, you're saying, this number, this age group should have been included dito po sa ilan na ho ba talaga ang percentage ng target population kasi nasama na po yung 5 years old and above. All right, so let's move on though. Doc Tony, do you foresee a rise in cases because of this voluntary policy on wearing of face masks outdoors?
Well, I can foresee a surge, Pinky. But of course, we know that it is mild at hindi transmissible masyado. At highly transmissible but not lethal. Yan ang description natin. But there are patients, Pinky, admitted in the hospital, mga elderly population natin, those with heart failure, diabetes, and hypertension. But not to a certain degree na ma-hospital sila. But there are more, Pinky, na outpatient based on telemedicines na hindi pumapasok sa opisina and causing family disruption. Ang problema, Pinky, is the rank and file. Yung mga arawan lang na hindi makakapag-afford ng day-to-day pag hindi sila makakapasok.
Opo.
Aanhin mo yung iba, where they have salaries, pwede yun. So it will affect our productivity, Pinky, as well as, of course, the long COVID syndrome na makaka-apekto sila kanila in 30% of cases.
But while this is already an executive order by the president, the DOH continues to appeal to the senior citizens, even those with comorbidities, na kahit outdoors, sana isuot pa rin yung mga face masks. Do you think, Doc Tony, paano ho ba to? Kanya-kanya na lang talagang diskarte, hindi ho ba? Especially with the seniors and those with comorbidities, because it's really just the DOH appealing to them or to us, kung sino man yon, na suotin pa rin natin yung face mask natin outdoors kung high risk yung tao.
Naawa nga ako sa Department of Health kasi as co-chair of the IATF, they yielded to the IATF and the local ordinance in Cebu. And dati, umaayaw siya doon mga 4 days ago. And then suddenly, in their website, sumusupport nila sila sa face mask. I think they don't want to be blamed and they don't want blood in their hands later on kung magka-surge. And that's why in their website, they're pushing for wearing of the face mask, whether indoors or outdoors, particularly in vulnerable population, which I think is a good thing.
Opo.
Na nilalabas nila yung position nila while supporting the national mandate for this executive order.
Okay. So, Dr. Tony, just an advice to the public?
I think the face mask is needed and I don't think it will interfere with the business. In fact, it will protect the people, the business in our country. So while we're still augmenting the booster program, please wear your face mask for your family, for your workplace colleagues, and of course for the country. And of course, support the Pinas Lakas and let's support the economy after boostering the population after a certain timeline. And this will be on the first 100 days of the president. And happy birthday, Mr. President. And thank you very much, Pinky.
And thank you, sir, Health Reform Advocate Dr. Tony Leachon. Pleasure always to have you. We will be taking a short break. Manila 6th District Representative Benny Abante will join us next. This is The Source on CNN Philippines. Please stay tuned.